the self-isolation webinar from our Be Healthy series. We will be recording the webinar so that we have it as a resource to use, and for people who can't be here today live, that they can hear what's been said as well. So the recording hasn't started yet, but it will do in a minute, and we'll say when. And just so you know that everything that's said and all the slides and stuff will be on that screen. Okay. Lewis, could you start the recording for me, please?
Yes. Okay.
Thank you. Hi everybody and welcome. This is our self-isolation webinar, so part of the Be Healthy Keeping COVID Safe series. It's roughly half an hour long today, and we have Rachel Chapman, who's a public health specialty registrar from our team, with us today to talk through the details on self-isolation. So we have housekeeping wise, just before we get started.
Stacey, sorry to interrupt. You're not on full screen.
Ah, thank you. We're on full screen now, sorry, thank you.
Yes.
So, just before we get started, a few housekeeping bits and pieces for you. So, when we're not talking, please can we keep our microphones muted or our cameras off? This will just help us save bandwidth. Also, if you have, via the organisation you work with, any VPNs, maybe NetMotion or Cisco, if you can turn those off too, we think it has a better, it works better as well. If you have questions, we very much welcome questions, and as much as anything, this is your forum to ask information that you need to be able to cascade this. You can either type them in the chat as we go along, and we'll keep an eye on that, or you can email questions to Healthy Brum if you prefer not to ask them in front of people. Equally, if you'd like to come in and ask an actual question, if we've not noticed, which we might not always have the boxes open at the side, just type, "Can I come in please?" and we'll pick you up. That'd be great, thank you too. As we've already said, today's webinar is being recorded live now. We are going to use it as a resource for people that can't be with us today, and just to spread the word about our self-isolation messaging and why it's so important. So, I recognise quite a lot of the names now, and I know you've been with us for quite a few of these webinars. So Be Healthy is a series of 16 different webinars. The idea is that we're building a set of practical resources. The webinar recording is part of that can help you to help you to disseminate these messages to the communities that you work with, to hopefully reduce their risk of becoming seriously ill from COVID-19. We're just at the end of the COVID Safe series today, and then we'll be moving on to more themed workshops. So we have Getting Mind Ready, a focus on healthy and unhealthy habits over the next 6 to 8 weeks. If you haven't booked any of the webinars and want to, the link is on the bottom of the page. So yeah, please go ahead and book. Yeah, and make sure you share the contents of the webinar and the future ones with your communities. So I'm going to hand over to Rachel now, who's going to talk about what self-isolation is and why it's really, really important in stopping the spread of COVID. So Rachel, I'll hand over to you. Thank you.
Thanks, Stacey. Thank you, everybody. So what is self-isolation? Self-isolation is when you do not leave your home, either because you might have COVID-19, in which case we would call you a case, or it could be that you've been in contact with somebody else who's got COVID-19, so you'd be termed a contact. But for both of these, you will be asked to self-isolate at home. And this is because this really does help to stop the spread of COVID virus to other people. And in fact, self-isolation is one of the most important ways that we can stop the spread of COVID-19. So coupled with social distancing and hand hygiene and catch it, bin it, kill it, self-isolation is a really key thing that individuals can do to help stop the spread of COVID. Are you moving the slides on, Stacey? Thank you. So in terms of when to self-isolate, there are a number of occasions when you will be asked to self-isolate. First of all, you must self-isolate immediately if you've got any symptoms of coronavirus or COVID. So this is in terms of having a high temperature, a new continuous cough, or a loss or change to your sense of smell or taste. If you have any of these, you must self-isolate straight away and then organise getting a test. Don't wait for the test result before you self-isolate. You must also self-isolate if you test positive for coronavirus. If you've already had the symptoms, you will already be self-isolating, but there are some people who don't have symptoms but then test positive, and they must self-isolate straight away as well. You also have to self-isolate if you live with somebody else who has symptoms or if they've tested positive. And this is from when their symptoms start or the positive test result. You also need to self-isolate if someone in your support bubble has symptoms or tested positive, in the same way that you would if they were a member of your household. Some people will be told to self-isolate by the national NHS test and trace system because they've been identified as a contact of somebody with COVID. And then the final time when you'll need to self-isolate is if you arrive in the UK from a country that's got a high coronavirus risk. And as we all know, this list of countries is updated very regularly. So it's always worth checking the website to see which ones this includes. So when we're talking about self-isolation, sometimes we need the whole household to self-isolate, and sometimes it's just the individual. So hopefully this will clarify that difference. The whole household needs to self-isolate if anyone in the household has got symptoms of coronavirus or if they've tested positive. So you only need one person in the household to have symptoms or a positive test, and the whole household then needs to self-isolate because they are at greatest risk of catching it from that person. This is the same, and it applies to your support bubble if you've been together in the 2 days before you got symptoms or tested positive. So your support bubble counts in the same way as your household. So if you've seen them in the last 2 days, then they will also need to self-isolate. There are occasions when it's not the whole household that needs to self-isolate, it's just the individual. And this is when no one has actually got symptoms or has tested positive, but someone in the household has been identified as a contact of a case outside of the household. So for example, they've been out at work and somebody else at work has developed symptoms, and because they were in contact with them at work, they will then need to self-isolate. In this instance, as long as that individual hasn't got any symptoms or a positive test, it's only that person who needs to self-isolate, not the rest of the house. Obviously, if they then go on to develop symptoms or test positive, then the rest of the house will need to self-isolate. So when we're talking about self-isolation, what does this actually mean? What do you need to do? You must not leave your home for any reason. If you need food or medicine, you need to order it online or by phone or ask for help for somebody to drop it off for you. You must not go out to do any shopping or for any other activities. You also must not have any visitors in your home, and this includes friends and other family members who don't live with you, unless it's essential care that you're receiving and that needs to carry on, in which case you need to make sure that whoever's providing the care knows that somebody in the household has got coronavirus or COVID. You also, if you're the person who's got the symptoms or the positive test, you must try to avoid contact with anyone that you live with as much as you possibly can, because this will reduce the spread of COVID to the other people within your household. So in terms of how to avoid spreading COVID to the people that you live with, there are some things that you can do while you're at home. So as much as possible, we would say try to stay away from the people you live with. So if you can, stay on your own in one room and keep the door closed so that you've actually got a physical barrier between yourself and the rest of the household. If you can have the window open to get some fresh air into your room, that also helps. You should avoid using shared spaces. So, for example, the kitchen at the same time as other people. Eat your meals in your room. If you need to prepare food, do it at a different time to other people in the kitchen. Also, use a separate bathroom if you can. If not, try to use the bathroom after everyone else has, and then clean it after you've used it. So especially the touch points, so the door handles, the toilet handle, the taps, those sorts of things. So there are some do's and don'ts in terms of trying to avoid spreading COVID to the people you live with. So the messages about hand washing are just as important here. So wash your hands regularly with soap and water for at least 20 seconds. And that should be the person with the symptoms as well as the rest of the household. If for any reason you haven't got soap or water available, carry around some hand sanitizer gel and use that. It's really important to cover your mouth and nose with a tissue. Or if not, sneeze into your sleeve when you cough or sneeze to try and prevent the spread of droplets. And then put any used tissues in the bin straight away and wash your hands afterwards. You should look to increase the cleaning in the house. So clean objects and surfaces that get touched often, such as the door handles, kettles, phones, etc., using regular cleaning products. If you have to be in shared spaces, consider wearing a face covering when you're in these spaces because that will reduce the risk of spread. And as I mentioned, try to keep the windows open as much as possible in the room that the person who's ill is in, but also in the shared spaces. And don't share towels, hand towels, tea towels, that sort of thing, because that can help spread COVID around. So there's lots of advice there for people to stop the spread to other people in their household. Now, some people might be contacted by the National NHS Test and Trace system and to be told that they need to self-isolate because they've been in contact with somebody outside of the household who's caught COVID. If this has happened, you'll be contacted by email, text or phone. The text messages will come from NHS Tracing and the calls will come from an 0300 number. Wherever possible, children under the age of 18 will be contacted by phone and asked for parent or guardian permission to carry on with the call. You will then be asked to sign into the NHS Test and Trace contact tracing website, but if you can't do that, it can also be done by phone. And this is where you will be given advice on what you need to do and any further information that the National NHS Test and Trace Service need to get from you. So then this next slide looks at how long you need to self-isolate for. And this is different whether you're a case, so somebody who's got COVID, or if you're a contact, so somebody who's been in contact with somebody with COVID. So if you yourself have got COVID symptoms, so on the left-hand side here, you need to start isolating for straight away. And this self-isolation needs to last for 10 days. You need to book a test. And we know this is challenging, and the message we're giving is keep trying, either through the internet or by calling 119. If you then test negative for COVID, as long as you feel well, you can stop isolating. But if you test positive for COVID, you must complete your 10-day isolation period. And the reason it's 10 days is because that's how long we think people are infectious for once they've caught COVID. Now, if there's people in your household, when you start isolating for 10 days, your household, as your contacts, need to isolate for 14 days. If you test negative, they can stop isolating. However, if you test positive, then they need to complete the 14-day isolation period, and you will be asked to share any other contacts with NHS Test and Trace. On the right-hand side, this is where you might have been in close contact with somebody who tests positive, in which case you might be alerted by the NHS Test and Trace system service. If this is the case, you'll be asked to isolate for 14 days after the last time that you had close contact with them. Now, during that time, if you then develop symptoms, you will need to book a test, and the rest of your household will need to start isolating for the 14 days. Again, if you test negative, you still need to complete your 14-day isolation period because you were a contact of a case, but your household can stop isolating. However, if you're test positive for COVID, you will then need to start a new 10-day isolation period because that's how long we think you'll be infectious for once you've tested positive. And your household will need to complete their 14-day isolation period. So what can go wrong if self-isolation guidance isn't followed? And this is a situation that we have already come across, unfortunately. And it hasn't been intentional, but the guidance wasn't followed, and there were sort of some bad consequences as a result of it. So actually the situation I'm going to tell you about, it's where an individual tested positive for COVID and their partner didn't self-isolate. So their partner carried on going to work, and their partner worked in a nursery with young children. But then the partner themselves developed symptoms and tested positive, which meant then that the whole of the nursery class and the other staff they'd been working with all became contacts of that individual, which was obviously was a worry for the parents of the children. It also meant some of them had to miss work while they were looking after the children because they had to self-isolate for 14 days. And it was a worry for the staff members. A couple of the staff members themselves had health conditions, so they were quite concerned. Now, if that individual had followed the self-isolation guidance and stayed at home when their partner tested positive, then we wouldn't have had the risk of spread of COVID in this situation. So it is really, really important that the self-isolation guidance is followed to prevent this sort of spread or potential spread from happening. And one of the things that we suggest is, and this might be something you can work with your communities on, is in terms of developing a self-isolation plan. So this is just spending a few minutes thinking through in advance how you could prepare if you suddenly needed to go into self-isolation. Because I think one of the challenges with self-isolation is at the point that you either develop symptoms or you are told you're a contact of a case, your self-isolation needs to start straight away. So I think as much as possible, any planning or preparation that can be done makes the whole thing much easier. So think about what you would need to do to be able to stay at home for the full 10 to 14 days. So things to think about might include food. So how would you be able to get food? Do you do online shopping? Is this something you could do? Or have you got family or friends who would be able to shop for you and leave it on your doorstep? Medication, particularly people who need regular medication for long-term conditions. Have you got enough medication that would last you at least 2 weeks? If not, have you got a plan for getting some more? Can somebody pick it up for you? Can you arrange to have it delivered? Any deliveries, it's really important that you let them know if you're placing an order that you're self-isolating so that the delivery can just be left on your doorstep. Caring responsibilities, and I know this is something that people really do worry about, that if you care for somebody else, it's really important to have a backup plan. So if you have to self-isolate, you know that you've got peace of mind and you know that the person that you're caring for will continue to be looked after. So a really important one to think through in terms of planning. It's also worth thinking about who you would need to let know. This could be work, it could be school, it could be, you know, if you do any volunteering, anything that you might be involved in that you need to let know. And then finally, in terms of getting help, so what to do if your symptoms get worse. So in terms of getting food and medicine, if you can order your food online, we know that supermarkets have introduced more delivery slots. And it's important to specify you want your order left outside your home for collection. If you can have your prescriptions delivered, some pharmacies have introduced a delivery system, so ask your local pharmacy or GP surgery. If you do get stuck and you can't arrange either of these and you've got nobody else who can help, there is an emergency response hub at the council and the web links there and the phone number. So please get in touch and they will then be able to signpost you to additional support. There's also the NHS Volunteer scheme, and if there are volunteers in your area, they might also be able to give some support. And again, we've provided the links there, so this is information that you can share with your community. One of the things that people obviously are very concerned about in terms of if they have to self-isolate is financial support. And there has been, obviously there was the news released yesterday about additional financial support for some people while they're self-isolating. It's really important that you inform your employer and the reason why. And if you can't get sick pay, you might be entitled to statutory sick pay or another type of financial support. So it's worth going on the gov.uk website to find out more about this. And then looking after yourself during self-isolation, and these are a lot of the links in terms of the Be Healthy work that is going on. Particularly if you're a contact of somebody with COVID, so you don't feel ill yourself, but you are stuck at home for 2 weeks, there are some resources here about keeping active and different ways to do this. It's also really important that people look after their mental health. So this is whether you've got COVID symptoms yourself or whether you're a contact of somebody. Different ways to stay in touch with people, using social media or different ways of going about it, and other things to think about in terms of looking after your mental health, which is really, really important during self-isolation. Also important to follow healthy eating, so some advice there on healthy eating and drinking well. And finally, working at home. If you're a contact of somebody with COVID, so you feel well yourself, different ways of working and learning while you're at home for your self-isolation. Just to cover off what to do if you have symptoms and they get much worse, this information is all on the NHS website. We just wanted to flag it up that it's really important that you seek further help, either through NHS 111 or if your symptoms are particularly serious, that it's through 999. I'm not going to go through all of these details because you'll have them through the webinar links and it is on the NHS website, but it's important to know what to do if the symptoms get worse. And then we have a short testimonial. Stacey, if you can press play.
I'd like to quickly share my It is very important that we listen to government advice and comply with COVID laws. I'd like to quickly share my story with you so everyone understands why it is vital to follow guidelines. My mother recently returned to England from abroad. She is in the vulnerable category and had kidney conditions and diabetes. On returning from a holiday, she was self-isolated and took a COVID test, which was positive. We had a large family of 30 plus living in several houses. Although our mother returned from abroad and we haven't seen her for a long time, we decided as a family not to visit her, and all of us who live with her took COVID test. My message to fellow citizens of Birmingham is simple. Please follow government guidance. If you have symptoms, self-isolate and take a test. We all need to behave sensibly and take responsibility. We all need to do our best with our bit to protect each other, our family, friends and loved ones.
Thank you. I'm sorry that the start of that, the sound wasn't very good, but it was actually somebody talking to us. They'd actually been in a position where somebody was self-isolating and just actually recognising the benefits of it and how they'd managed to keep other family members and friends safe. So I think now it's open up for questions.
Yeah, thank you. Sorry about the sound on that clip. I couldn't make it play any louder as it was going on. I'm not quite sure why. But if you have a listen back, hopefully you'll be able to turn up the volume on it. It's really powerful and might be something that you can share. So thank you to Rachel. Really good information, really clear again. Hopefully gives us all a good understanding of what we should be doing if and when we need to self-isolate, and hopefully something that we can share with friends, family and people that we work with. Like all of the webinars, the discussion at the end we've been trying to have about how we will disseminate these messages to people that we have contact with. So if you have any thoughts on that, any questions about how you might do this, or anything else you want to know about self-isolation, if you want to start typing in the chat, we will pick up the questions. Equally, if you want to send them in separately, that's fine too. I'm just going to open the chat now so I can see. Okay, Rachel, I'm going to read this one out. Hi, so this is from Jazz. Hi, do we know why some people don't self-isolate? Has any research been done into this? Apart from perhaps being asymptomatic, thinking they're not going to be too badly affected, I know that some people feel they can't self-isolate due to work, financial reasons. For example, employers not understanding forcing people to be in the workplace and or not receiving sick pay. The £500 payment announced recently may not apply to everyone or be enough, and it feels like it's yet another inequality which puts some people or groups at increased risk. Rachel, you're muted, I think.
I think that is a really, really important question, and I think you make some extremely valid points there. I think we do need more research into why people aren't self-isolating. I suspect with some, it's still perhaps that lack of understanding of really what we mean by it, and particularly when you're a contact. You know, if you have symptoms, it's perhaps a little bit easier to understand in terms of spreading it to others, but when you're a contact, it might be that it is more difficult. I think in terms of what you said about people, you know, the financial impact of self-isolation is very significant. Obviously, we've had the announcement this week, and we need sort of a little bit more detail on how that's going to work. Yes, I think it is a challenge, and I think it's something that we need to continue raising as a challenge, particularly for some areas of our communities. We have to be very mindful of this.
Yeah, thank you, Rachel. So we have another question from Tina. If someone tests positive, are they non-infectious after 14 days?
Good question, Tina, and I know also all the times get a bit confusing. So if you test positive, we consider you to be infectious potentially up to the 10 days. So if you've tested positive, you only need to self-isolate for 10 days. And that's the period of time that we think you're infectious. If you're a contact, it can take up to 2 weeks to develop the disease, and that's why the 14 days if you're a contact is different to the 10 days if you've actually got the symptoms or test positive.
Thank you. It is confusing, I suspect it is. Yeah. Hopefully this will help everybody get it clear and be able to give out some clear messages and help us with that. Are there any other questions, or I'll give 1 minute to see if anyone else is typing. But no, they're really valid questions, and I think, yeah, hopefully by asking the questions, other people will get the information they need as well. Sometimes you don't realise until someone asks that it's something maybe you wanted to know too. So I think what we'll do is we'll move on and towards the end today. So we're moving on to keeping in touch. So this is the same as always. All of our information is on the Be Healthy section of the Birmingham City Council website. all the webinars and the resources as well. If you have any questions or inquiries, if you want to email us at Healthy Brum, we'll get back to you as soon as we can. We're also on Facebook, Twitter and Instagram, so if you want to, you can follow us for up-to-date messaging there, and you can also share this with your community groups or other people that if you share, it'll spread the word that we're spreading even further and be greatly appreciated. So I think for today, all that's left is to say thank you for everybody for joining us, and a big thank you for Rachel. I know that's 2 in close succession for us and a big ask, but thank you. I think they're really important messages and very clear. So that's all for now. And yeah, hopefully we'll see some of you at the rest of the webinar series. Thank you. Bye-bye.